This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, so quickly, we're just going to go over the Penn PM&R residency program. We're really excited to be here, and Erica will be monitoring the chat and then vice versa when we switch over. So please feel free to put any questions in the chat. Otherwise, our contact information will be shared with you later. So definitely feel free to reach out. So our program, we have 24 residents, so we have 6 in each class. And for the interns, we have 4 categorical residents, and then we have 2 advanced residents that join us as PGY2s. And then in terms of our rotation sites, we're kind of throughout the central Philly area. So we're in Center City as well as University City. Here we have a bunch of the sites that we rotate at. So I'll just go in order. So up top on the left is Penn Medicine at Rittenhouse. So that's our main rehab hospital. It is a standalone facility. And then going through, we have the VA Medical Center. We're the only program in Philadelphia that does rotate at the VA Medical Center. So it's a really great exposure that we have to serving our vets. Then we have Pennsylvania Hospital, Children's Hospital, also called CHOP, really great experience for us. And then we have Penn Presbyterian, which is a level 1 trauma center. And then we have the newest spaceship looking hospital is the HUP Pavilion building. And so this is where we spend most of our inpatient and consult time. And then next we have, these are just some pictures of the outpatient sites. So we have the Perlman Center for Advanced Medicine. That's in the same area as HUP, CHOP, all of those hospitals. So there's a nice little hub right there. And then closer to our Presbyterian Medical Center, we have 3737 Market, which is also an outpatient facility. And then lastly, we do rotate at Waitman Hall, where we get really great sports coverage and sports medicine exposure. And so I think it's much easier if you actually look at a map. So we are located at all the yellow stars, if it's easy. I'm not sure if you guys can see my mouse, but so it's kind of split into half that most of our sites are in University City, really easy to travel to. If you want to walk, that's fine. If you like to take the trolley, bike, bus, it's really easy to get back and forth. This right here by Rittenhouse is our main rehab hospital. And then on the right, which is considered Old City, that's where we have our Pennsylvania Hospital, where we do consults. And if you do your intern year here, you'll spend some months there on internal medicine. And so in terms of the intern rotations, we do, it kind of mirrors the transitional year a bit. So you get varied exposure in general surgery, neurosurgery. We do family medicine, internal medicine, neurology, peds. You do get 2 full months of elective, which is really great. And you do get 1 full month of PM&R, which I think is really awesome as an intern. And then as you move along as a PGY2, like many other programs, this is where you get the bulk of your inpatient experience. So we spend 2 months at CHOP, which is, really early exposure to pediatric rehab. And then we spend a total of 6 months at our inpatient rehab hospital. So we rotate through different services, like we have them listed here: medically complex, stroke, spinal cord injury. And then we do spend 2 months at the VA at the inpatient rehab there. And then lastly, as an as a PGY2, you do get some consult and like general rehab outpatient exposure as well. And as you move further along, you get more outpatient and more consult experience. So as a 3, you do spend 2 months on the inpatient brain injury unit, and then as well as the CHOP inpatient rehab. And then the rest of it is really just consults throughout the different sites and going on clinic as well. And then PGY4, Again, very similar. We spend a ton of time on outpatient through the different specialties, and we get most of our EMG exposure at this time as well, in addition to more elective. So I would say our rotations kind of mirror other programs as well, where it's inpatient heavy in the beginning, and then you get more and more outpatient as you move along your training. And then in terms of electives, I've mentioned it's really open to whatever is your interest. So if there's some people who are really, dead set on sports medicine, you can get some of that exposure early. We have many people who are interested in like interventional pain. They kind of get their foot in the door with the anesthesia folks. So the electives are a really great time to either further your interest or actually kind of go a little bit outside if you want to learn something different, like wound care, or spend some time with our interdisciplinary teams. That option is available to you. And then I guess everyone's favorite topic is call. So for us, we do in-house overnight calls, and then you have a post-call day the following day. These are pretty front-loaded, so the PGY2s take most of the calls, weekends and holidays as well. And then as you become more senior, those do decrease in frequency. So I would say on average, a PGY2 might do somewhere around like 28 calls. And then a PGY3 would do somewhere around 20, where more of them are on the weekdays. And then as a 4, you do maybe like 10 to 12 calls. And when you're a 2 or a 3, you would cover home call for the VA. And this is really minimal. Usually you don't get called at all. But we do just need someone on call for the VA for, the handful of patients that we have there. And I'll let Erica take it away.
Yeah, going into some of our education parts here. All right, so we have protected didactic time every Wednesday from 9 a.m. to 1 p.m., which is a great time. We all get to meet up from our different rotation sites, and it's always protected. So we either have an NP or the attendings kind of sign into patients so that we're not like interrupted by Epic Chat or anything like that. It's a good structure. We do the same curriculum each year and kind of repeat it so that it kind of gets ingrained pretty well. And we have a resident run kind of board review, which has been, I think, really helpful the last couple of years. We've changed it around a little bit. And really it's just focusing on like the high yield stuff. We try to do a lot of sim labs. We actually have a big sim lab center in our building that Penn uses for a lot of their training. So that's a good resource that we have. And then sometimes we have like Botox reps and things like that come with some sim components. And then of course, it's great. We get free lunch every Wednesday. So that's huge. And free coffee 24/7, which we've all taken advantage of. It's a good Keurig. Next slide. Yeah. So this is just an example of like what our month didactic schedule would look like. Every lecture we have is pretty much an hour. Sometimes we have 2 journal clubs that we put into an hour slot. And then most days we have like a resident doing a resident run board review, which is great. We break our year into modules. So right now we're in the MSK block, which is usually a couple months long because it's such a big block. And then we'll do like spinal cord, TBI, P&O, things like that. And then we also do grand rounds once a month, and that's junior and senior grand rounds. The junior grand rounds is going to be a PGY2, and then the senior grand rounds is going to be a PGY3. And those are really great because a lot of attendings join and actually get CME credit for that. So that's usually like the big presentation that you'll give each year, and then you'll each do a journal club as well. Those are just some pics. Right now we're doing our anatomy course, which is also resident run. It's eight Thursdays in the summer that we meet, and we are actually in the Penn cadaver lab. So we have some prosected cadavers, and we actually have the Penn anatomist who do every joint that we're doing each month. So that's been a really good review every year that we repeat that curriculum. And then we usually do ultrasound as well, where we kind of go through the AMSSM like sports criteria for each joint. Sometimes we'll do it like once a week for a couple months, or sometimes we'll spread it out. This year we might try to add it into our didactics. But just good ultrasound review, and we have some really good ultrasound equipment that we use in our outpatient clinic. And then, 3s and 4s are always available for EMG teaching for any of the 2s that are trying to figure out what's going on, because it takes a while. And then every other week, the therapists give us a half-hour lecture for the inpatient crew on a therapy topic. All right, and you'll probably see this at some of the other Philly programs, but we do these great citywide meetups where different rehab residencies will host different days, and it's kind of like a full usually 2 days where the 2s and 3s or the 3s and 4s from each program will meet up and just learn all about a topic. So like Moss usually does gait, and then we usually do ultrasound, and then we'll do prosthetics as well, and Jefferson does EMG. So those are really awesome, and you'll see those at a lot of the Philly programs. And then, you know, some of the benefits and the fun stuff, we do get an education stipend. I think it's like $650-ish a year. I don't know, it changes a little bit. But you can use it for whatever. I just used all mine for a laptop, so there's that, but I needed it. And then we have a Board Review course that's paid for, and that's a full week for the PGY4s. And then if you present at a conference, if it's original research, such as like a cohort study or anything kind of more advanced than that, you'll get funding for the conference. And PGY 3s and 4s get 3 days of education time to go to conferences, or if they want to go to like a course, like I know Pollock's going to spasticity course next week. So that's an option too. And then we get, you know, free enrollment in AAP and PM&R, like our department pays for that, so you don't have to pay for membership. And then
I think that's research.
yeah, oh, research, yep. So we have a research project that every resident does before they graduate. It's pretty flexible, it can kind of be whatever you're interested in doing. It just has to be a little bit beyond like a case report, and usually it's at least a cohort study, or a lot of us do systematic reviews. And that's built into our didactics as well, like kind of how to do a study. We have tons of support. I think being at Penn, you know, you don't really realize it until you're there, but there's so many faculty that do a lot of research. So very willing to help residents if you're really interested in kind of that research side. And if you're not, that's fine too. You could just do your one project like I did and get it done. And no problem with funding for that too, if you're going to travel to a conference. All right, sports coverage. This is a good one for me because I'm applying for sports right now. So I'm just like you guys, sitting in my interview chair, getting ready for fellowship interviews. And I've been very happy because Penn has amazing sideline coverage opportunities, and that's partly being in Philly and partly just Penn's a really big network. So we have a lot of mass participation events like Penn Relays, which is huge. So you get to see high school, professional, college level athletes. And then we do a lot of like runs. The Broad Street Run is super fun. And then we have opportunities to do like sprint football sidelines, a lot of pre-participation physicals. They're actually doing them right now for the Penn athletes. Yeah, and then if you're interested in any like sports sideline coverage, like there's more than enough opportunities. So it's been good. Yeah, Pollock, maybe you want to talk about this
Yeah,
one.
so if you're interested in something else, there's also a cool thing that they do at Penn called the Healthcare Leadership and Quality track. I have done it, so have the past, I think 3 years of chief residents and PM&R have done this program, but essentially you get really advanced training in doing QI and patient safety initiatives. You get connected with all of the like administrative clinical leaders in Penn, as well as the department. So I think it's a really wonderful leadership role, whether you are considering, you know, healthcare leadership, being part of a hospital board, or if you want to be part of program leadership. You know, as you go further along in your training at an academic center, I think this program is really wonderful. And if you have specific interest in quality improvement, I think this is a really great opportunity that we get. And it's built right into residency, so you're not really doing anything extra. And this is open to everyone at Penn, so you get to interact with, you know, all the other different specialties through this track. So.
Yeah, and I think one of the huge things to emphasize is that our rotation sites are so close together. We even have a couple residents that just walk. A lot of residents use the scooter thingy, whatever that's called, or bike. And then some of us drive as well. So the sites are really close together, which I think you don't really think about until you're at a place, but it makes it so much easier to also hang out after work, because most people live kind of in a close vicinity. So it's really easy to like go for happy hour or whatever right after work, because we're all like right downtown or near there. And yeah, Philly's a great city. I've been here for like 9 years now because I did med school here too, and really love it. It's like, it's big enough that there's so much to do, so many great, I think, underrepresented like restaurants that are incredible and probably New York standards, some would argue.
Yeah, I
And
can quickly chime in that I was like I don't want to say the biggest Philly hater, but I was always like team New York since I grew up close to New York City. And I can confidently say that, like, Philly is a really, really wonderful place to live, to train. You get everything that you'd want in a city.
5-minute warning.
You get all your restaurants, bars, whatever you want. And it's much more affordable. So yeah, I am a Philly convert.
yeah, big fan, and a lot of outdoor stuff too. So yeah, we'll and sports for those that are interested, for sidelines and for attending. But yeah, go Birds. But yeah, in general, yeah, and also we do a monthly wellness thing as well. Like we did a ski trip this year. We go out to happy hour a lot and go out to dinner and pumpkin picking and apple picking and whatever seasonal activities we could do. We did axe throwing last month.
Some more.
Lots of picks, but regardless, I think Pollock and I are both super happy where we ended up, and honestly have really enjoyed residency in our program so far. And I think, congratulations for you guys picking an awesome field. I think wherever you end up, you're going to be super happy. And we have a good variety and where people have matched. This year is a little heavy in sports, but it's super random. Last year we had some pain. Pollock's doing brain injury. We had spinal cord last year. And the benefit of Penn is we have pretty much every fellowship in-house, except for spinal cord. So if you want, like, it makes it really easy for trying to get letters for applications, because you're going to get exposure to all the different fields, and also just figuring out if you're like, I don't know what I want to do, or if I don't want to do anything, you can do general. 2 people are doing general. So the options are there. Yeah. And yes, Pollock put her plug in for the.
Yeah. So this is our last slide. So Mike is our other chief resident who couldn't join us today because he has a newborn, and I think that's important. But right here, would just recommend that if you wanted to learn a little bit more about our program, I would definitely give us a follow on our Penn PM&R residence page. That's run by us. So we post, I think, some sillier things and some more of our wellness things. And the Penn PM&R Instagram is otherwise our department run Instagram. But if you guys have any questions, definitely feel free to reach out to either one of us. And let me stop sharing my screen and see if we have a minute or two for any questions.
Yeah, I think for general questions, it looks like someone's asking about any step 2 score cutoff.
Not
Interviews
that I'm aware of, to be honest. I think, like other programs, we still look at all the applications holistically. And so, we want to know whoever would be a good fit for our program, but it's also important for you guys to know, would you feel like this is somewhere that you'd want to train? Do you feel like you'd work well with us also? So it's just as important for your end. And then the census. So for the inpatient rehab hospital, we have about, I want to say it's like 58 beds, or let's say like shy of 60
2-minute
beds.
warning.
Inpatient. And so every resident is capped at 14. So we have 3 PGY2s that are on service covering like medically complex stroke and spinal cord injury. And then we have a PGY3 that is on the brain injury floor. And okay, more questions. So multiple residents, everyone is there for the 60 patients. So, you never really feel too overwhelmed. Global health, yes. Actually, there's like a newer initiative where we are able to send residents to Botswana to work in the rehab department. They get amputee exposure, general rehab exposure. That's a newer thing. So we're working on that. But hopefully by next year, our first residents will be joining Botswana.
We do have formal mentorship.
Yeah, neurosurgery, you do not have to be in the OR at all. I never stepped foot in the OR. I think if you wanted to, there could be opportunity, but it's really just managing the floors. Same thing with general surgery.
Yeah, guilty. That scared me away from doing categorical, but honestly, you would have been fine. I didn't need to do it.
Mentorship, you do get paired with a mentor, like formally when you first join here at Penn, but all the attendings are super approachable. So if you feel like you have an idea of what you're interested in, or, you just happen to meet someone in clinic and you feel like you get along well with them, anyone is really happy to be your mentor. So you do get someone formally, just, in case you feel like you have someone and you don't have to go searching for them, but you can definitely, switch as you see fit with your goals.